Prior to taking somebody's vital signs, there are a few things that we need to do before starting. The first one would be hand washing.
Second step is sterilizing your equipment.
The third step is to introduce yourself to the patient and obtain 2 identifiers.
The fourth step is to explain the procedure to the patient.
3.
The final step is to get informed consent from the patient.
A patient's pain level, you first ask them on a scale of 0 to 10, 0 being no pain, 10 being intense pain. You can also ask them to describe the type of pain, examples being throbbing, shooting, sharp, dull, or deep pain. So first I'm going to ask my patient Joya to describe her pain on a level scale of 0 to 10.
My pain's at about 4.
Okay, and could you describe that type of pain?
It starts in my neck and it shoots down my back.
When taking somebody's respiration rate, we want to simulate as if we were taking their pulse rate, so that way they do not know that they are getting their respiration taken and they do not breathe normally. The best way to accomplish this would be to simulate taking the pulse and laying it on their abdomen, so that way we will be able to watch the chest rise and fall and also be able to feel it in their abdominal or their stomach area. This is done doing it for 60 seconds, and normal ranges for that would be from 12 to 18. So, with that being said, we are going to take Katie's pulse rate, or her respiration rate. I only did it for 30 seconds this time, so therefore I need to times that number by 2. Her rate was at 7. So timesing that by 2 would give her a normal rate of 14.
When taking someone's pulse, you want to select a arterial site and firmly but gently place 2 fingers over the site. 2 common sites are the radial and carotid. Other sites that can be used are the temporal, which is on the head, the carotid is on the neck, the brachioradial is on the forearm, the radial is on the thumb side of the wrist, the femoral is on the thigh, the popliteal is on the back of the knee, the posterior tibial pulse is on the top of the foot, and the pedal pulse is on the inside of the foot. To take a pulse, you put your hands on the arterial site and mentally record the pulse for 60 seconds. Normal pulse rate is 60 to 100. So I'm going to take Kevin's pulse. Kevin's pulse for 30 seconds was 34, so to get that for a minute, you would multiply it by 2 and get 68 for his pulse. You also want to avoid using your thumb when taking a pulse for someone, because you may get your own pulse rather than the patient's.
Okay, when taking someone's blood pressure, you need to start by exposing their antecubital part of their arm right here. So this is pretty easy because she has short sleeves on, but if she has longer sleeves, then you'd roll her sleeves up and make sure there's not too much pressure on the arm. If you're able to, you can palpate the brachial artery to know where you need to place the stethoscope on the arm. Some people can't, so it just depends on practice and your ability. And next, you want to apply the cuff and put the bladder of the cuff over the medial aspect of the arm. So right here, you can tell on this cuff it's nice because it says right arm, and then you put it right, there's an arrow to where you should have it. When you start to pump up the cuff, you want to pump it up till you cannot hear the pulse in the arm anymore. So I'm going to show you how to do this. Okay, her blood pressure was about 109/72. When I pumped it up and and released the pressure, I was listening for the first Korsakoff sound, and that would tell you your upper number, which hers was 109, and that would be the systolic number of your blood pressure, and then you listen until you don't hear the sound anymore, and at that point where the needle is, that's your diastolic number. The average for an adult would be 120 systolic or lower, and 80 or lower for diastolic.
There are several modes of obtaining body temperature. There's the ear thermometer, which we're going to be using today, the oral thermometer in the mouth, and the most accurate, which is the rectal thermometer. The normal body range temperature is 96.8 to 99.3. So today I'll be taking Katie's temperature with a ear thermometer. If it's a child, you're going to want them on your lap. With a person, you just have them sit. I'm going to place the thermometer in your ear, and I'm going to hold the button for 1 second.
So you don't want him on?
Her body temperature is within normal range, 98.1.